I'm confused. Did you just turn this on or off? Because I thought there'd be one signal if you waited till Frobe was done and turned it on, but it'd be truly a different signal if you turned it off as I was about to speak. Let me just say, at the Center for Health Transformation, part of our initial concept was that you couldn't manage changing the health system because it's too large and too complex, but you could gradually create a migration. You're dealing with the largest single sector of the economy, the lives of over 300 million people, an intellectual effort which is stunningly complex and which is highly decentralized and has many different centers of power. And so to try to figure out how to amass enough power to force that system to change in a managed way struck us as almost certainly not doable. But what you could do is establish a direction. For example, that you need more information technology, and that information technology is really helpful. We've been able to do that on a bipartisan basis. And so one of the areas we're looking at is consumerism. But in introducing this, I want to make two sets of general points before you hear from real practitioners. The first is, if you get a chance to look through our handout from the Center for Health Transformation, we really think that part of what has made it hard to have a health policy discussion is that there are 4 different boxes that have to be filled in parallel. The first is actually personal responsibility and the personal social contract. Because if you don't start there, and I got to it by looking at obesity and diabetes, but if you take mammograms and the relationship to breast cancer, or if you take colonoscopies and the relation to colon cancer, if people aren't themselves engaged, if they don't think they have a social contract where they have some responsibility and some involvement, you cannot get the system to work. The second zone is, how do you then structure the larger society to emphasize healthy behaviors and to emphasize wellness behaviors. And we always talk at the center about a center for health transformation, not health care. Health care is a subset of the larger issue of health. And so we first work on the question, can we maximize your health and optimize your self-awareness so that you have the healthiest possible life with the greatest independence for the longest time, which turns out to be at the lowest cost. The third zone is, how do you really fundamentally rethink the current delivery system so that when you do need health care, you get it from a 21st century highly sophisticated model. And there the center is working with Gallup and with looking at Toyota and looking at Ritz-Carlton and trying to bring together a synthesized system that would be the most advanced, the most technically correct, and maximize productivity. And we think over the next very few years, you're going to see dramatic outcomes. And then the last is, how do you finance it, which is where politics starts. So as a general rule, the politicians start in the fourth box, having skipped the first 3, and then find they can't solve it because the current system is not fundable. The current system will absorb everything you're willing to spend plus 12%. So just tell me the number you want to pass, and within 3 years the system will grow past that number and add 12%, because the current system is designed to absorb money. It's not designed to primarily focus on health. So that's the first box. The second thing I want to say before Congressman Burgess further introduces this and then introduces our practitioners is something which I'm absolutely fascinated with and have been since I first came to Congress as a freshman in 1978. There are real success stories in this country, but they don't count. Because they're not how the Congressional Budget Office scores, they're not how the Office of Management and Budget scores, and they're not how most of the specialty staffs think. So the specialty staffs are made up of people, some of whom have been thinking about this for 20 years, which means that their state of beginning would have been 1988. And we walk in, and we can show you around the country case after case of breakthroughs where people are getting better care at lower cost with better outcomes. And if you actually applied those directly to the Medicare, Medicaid, FEHBP, veterans, and TRICARE budgets, you would have savings, my personal guess is, you'd have savings in the zone of $20 to $40 billion a year with better outcomes. But they don't fit the way we talk about policy, and they don't fit the way, so what people basically say is, well, that's all really interesting, but that's not what we're doing. So we're going to keep doing what we're doing even if it doesn't work, because we at least know how to do the thing we're doing. But this new stuff that would work doesn't fit what we're doing because we don't know how to do it, and it's too hard to learn. And this is an enormously hard problem, and what makes it harder is all of you are really busy. And so real learning requires slowing down. I mean, it would be possible, we'd have to figure out the technicalities under ethics rules, but it would be possible to put together a tour during a break where you could take staff around and the only places they would visit would be success stories. And at the end of 4 or 5 or 6 days, they would have been immersed in places that only have one great virtue. They work every day. They're stunningly less expensive, stunningly more effective, having better outcomes, and people actually like it. But it would be very different. And then you have to ask yourself the question, now when am I going to find the time to translate that into public policy? The normal cycle for doing this is 15 to 20 years. If you go back and look over the last 60 years, how do big ideas gradually get accepted? It's a 15 to 20 year cycle. And what we're trying to figure out how to do at the center is how do we shorten this dramatically so it's a 3 to 5 year cycle, which is still too long, but at least gets you in the cycle of the way modern technology is working. I'm delighted to be here. I'm going to listen all with the rest of you, and then at the very end try to maybe take a few questions and wrap up. But I'm very excited. Let me also say we are very excited to work with Congressman Burgess. He is both, a practicing doctor, which gives him he has a unique capacity. He actually has done the stuff we talk about. And now he's up here trying to do the stuff we talk about to the people back home who are doing the stuff he used to do when he complained about the people up here. So he has to now bear the burden of trying to be good enough at health policy that he can go back home with a straight face and explain to them what he's trying to accomplish. And it's very exciting to work with him. He's doing a lot of very, very interesting things, and I'm just thrilled to be here. And I think it's your turn.